Okay, this week we're going to talk about the immune system and autoimmune disorders and HIV. So if you're following along in your Lippincott book, it's Unit 8, starting with Chapter 35, 36, and 37. Chapter 35 is just an assessment of the immune system. That should be a review for most of you. However, if you're not really familiar with it, you might want to go over that because some of that stuff is going to be on your test. A couple things I want to point out in that chapter if you're not familiar with it. I love this diagram, figure 35-1, where there's that guy there. I want you to look through that because it talks about what areas in the body and what structures in the body are important in the immune system, just as a refresher. Other things that we're going to be talking about, your bone marrow, your lymph system, the thymus, it's that organ that is born in infants and then slowly goes away as people age. Check out also Table 35-1 on page 970, just so that you're familiar with some of those words, because there's a difference between like an autoimmune disorder and an allergic reaction and an immune disorder. The other diagram on in chapter 35 that I really like is figure 35-6 on page 975. Look at the top there. I love how that gives a really good description of what an antibody is versus an antigen. Sometimes it's an exact match and you get really good response from your body, like can fight off the infection really well because it's a good match, and other times not so much. So I do like that. Go through some of these, like make sure that you know like the T cells, the B cells, the lymphocytes, just sort of a general overview. You don't have to be an expert in it, but you have to have a general overview of what the structures do in the immune system. Let me give you a quick overview because I see a lot of times that students get a little bit confused about what the immune system is or does. I want you to think of it like this. Think of your body and yeah, you're going to think of your body as like a castle. And within that castle, you've got you want to defend the castle. You need to defend the kingdom. So you've got a lot of things in place to defend the kingdom. You've got your moat out there. You've got your armies out there. You've got your soldiers out there. There's different ranks of your defense. So you've got like the generals in the back. You've got your soldiers in the front. Kind of like a chess game where everybody has to do something, but they all have different roles, and every role is equally as important. When you have an immune, like an immune disorder or an allergic reaction, what happens is all of a sudden you have incoming. You have something that's trying to break the defense because they want to get into the kingdom. They want to cause disruption within the castle. So you have something coming in that isn't supposed to be. And so your whole defense system, that's your whole immune and allergy response. Sometimes when you have an allergy coming in, it's something that is present out there outside the kingdom and is trying to get in, and the people, the defense team, your armies and your generals and your soldiers that are out there, they masked a response. So let's say you've got an allergy coming in over here and you've got your soldiers lined up here. All of a sudden you need to call in some soldiers that are over here to come help fight this battle right here. And in the world of anatomy, what happens when you have that allergy come in is that all of a sudden you'll have a histamine response. You want the histamine response because what happens when your body releases histamine in the presence of an allergen is that the tissues will swell. You might have some hives and itching. And sometimes that's good. Sometimes that gives you an indication that you are in the presence of something your body doesn't like. And if you have a normal working immune system, you'll have the release of histamines, And then you can do other things like rest, fluid, take antihistamines like Benadryl, Sudafed, things like that to kind of call in some supporting forces and help contain the allergy. In some conditions with allergies, the patient gets overwhelmed. So the allergy is coming in, and in a normal person, they wouldn't have mount a response because their body doesn't recognize it as an allergy, or they're able to defend it off. And what I mean by that is like people with a peanut allergy. There's millions of people that can eat peanuts just fine with no problem. Their body doesn't recognize that as a big issue. But then you have other people that have one little bit of allergy, peanut butter, and then all of a sudden the body says, whoa, there's a foreign enemy here, even though in most people it's not really foreign. That person's body thinks that it's foreign. So it will mask up this allergic response and release histamine. Histamine will cause inflammation, and if it's bad enough, it'll start. That's what causes the anaphylactic reaction. You really worry about it when you get swelling in the oral cavities and airways, because then it causes the airway obstruction. So you give them really, really potent anti-allergy medications like epinephrine. Those people have to carry epinephrine pens. Bee stings are another thing that some people can have a severe allergic reaction to. But there's other things like seasonal allergies or pet dander that a lot of people, they'll just get like the itchy eyes, the runny nose, that kind of thing, because their body is recognizing pet dander or something as a foreign as like the enemy, whereas other people don't have that. So that is an allergic reaction. An immune response, but the allergic reaction doesn't mount the white blood cells and the T lymphocytes and B lymphocytes. It's just pretty much the histamine release that causes itching, hives, swelling, depending on the severity of the allergy. The immune response now is recognizing that there is a foreign enemy coming in, and it's serious. So, and everybody will have the same reaction. So, for example, I shouldn't say everybody without an immune disorder will mount this response. So, for example, everybody who's exposed to like E. coli, if you are exposed to E. coli or Staph aureus or any of a number of bacteria, your body will mount an immune response because you're born with immunities. You're born with innate immunities. You get some immunities from your mother, especially if she breastfed you, because there's immunities in breast milk. So when you're born, you weren't born with some, that's your innate immunity, and then you start getting acquired immunity. So when you are in the presence of a bacteria, your body will mount up an immune response and start recognizing, oh, this is a foreign body. This is something that I need to fight if I ever see it again. So that's why little kids get sick a ton. And when you first start practicing as a nurse, you'll get sick a lot because your patients have a lot of bacteria and stuff that you probably haven't been exposed to. But then your body will, if it's functioning well, will mount up an immune response, recognize that is foreign enemy, and then the next time that enemy comes in, boom, your soldiers are right there to fight it off, so you can fight off that infection. Sometimes patients have an immune disorder, either they can acquire it because of other things, they can be born with it, and there's another type of disorders called autoimmune, where the body, like the kingdom that I was telling you about, the castle, actually is almost internal. So it's like fights itself, like all of your soldiers all of a sudden are turning around looking inside the castle and fighting like everybody who's in the castle who's supposed to be working inside the castle. Now the soldiers are fighting them. That's what an autoimmune disorder is, meaning a self-immunity. Things like rheumatoid arthritis, lupus, what are some other ones? There's actually quite a few autoimmune disorders where the patient is actually allergic to itself. And those patients, then you have to put them on immunosuppressive drugs. You want to suppress the immune system. So that's allergies and immunities in a nutshell. That's basically chapter 35. Couple other things, table 35-2 on page 976. You don't need to memorize all the interleukins, interferons. That's a little too advanced for what we're doing here. The other things in chapter 35, I do like these charts, these assessment charts. I think are really helpful. Chart 35-3. That is super important to know as a nurse, because you have to know, how am I assessing the system? How do I know if it's working or if it's not working, if I need to do some interventions? So kind of focus on that, so you know what the heck you're looking for. And table 35-4, it's always important to know how these kinds of disorders are different in the elderly, because the elderly always have one extra layer of complexity that you have to deal with because of dehydration, forgetfulness, decreased renal functions, that kind of thing. So, anyways, let me see what else I want you to know. I'm skimming through chapter 35 really quick. So if you're not super familiar with allergies and immunities, spend a little more time in chapter 35, but if you're pretty good with it because of, you should have had it in physiology and pathophys, then you can kind of just skim through that. So let's now move into chapter 36. So how do we manage patients with immunodeficiency disorders, meaning that our immune system, our soldiers and generals that are like defending our castle, and if any of you guys play like COD or that Modern Warfare, all of those video games, you know what I'm talking about. There's like different levels of soldiers and different kinds of enemies and stuff that you have to defend and to protect your people and to protect your team. So that's kind of the same concept. Immunodeficiencies can either be something that you're born with, and if it's something that the patient is born with, the symptoms will show up early in life. Those kids will get infections that they don't get over quickly. They usually have, some of them are severe enough, and you'll read it in this chapter, some of them are severe enough that they'll have, facial dysfunction or facial dysmorphias. They can have cardiac problems. If some of these that have a genetic component to them. Other autoimmune disorders are acquired, and the classic one that you're probably all familiar with is patients who are on chemotherapy, because what chemotherapy does, it goes into the veins and it attacks fast-growing cells, because most cancers are fast-growing. So if you have a slow-growing cancer, I'm trying to think off the top of my head what a slow-growing cancer is. Like chronic lymphocytic leukemia, really slow-growing leukemia. Those people don't need chemotherapy because it doesn't attack the cancer cells, because those cancer cells grow slowly. But most cancer cells are fairly quick. So the chemotherapy will attack fast-growing cancer cells. That's why people lose their hair, because your hair grows fast. They lose their nails. They have nausea and vomiting because your GI tract changes over quite a bit. But the other thing that it does, your white blood cells also change over pretty quick. There's a rapid turnover, and it will suppress the white blood cells. And now those patients they're immunosuppressed. Now what you've done is you've just wiped out some of your army that's trying to defend the castle. They're not there anymore, so now they're immunosuppressed, and so now if another enemy comes in, you don't have as many forces there to try to defeat the enemy. So that is a secondary immunosuppression to some other problem. So keep that in mind. Okay. I do want you to know a little bit about the common variable immunodeficiency. That's one of the CVID. You'll see that in this chapter quite a bit. That's a really common primary immunodeficiency. It would be the table 36-1. Skim through that. There's a lot of information in there. It might be a little bit confusing, but it's a good idea to know, what do the phagocytic cells do? What do the B cells do? What do the T cells do? And some of the disorders that are associated with them, but you don't have to memorize that. Just sort of keep that sort of in the back of your head as we're going through here. Okay, now these next couple pages, they go through each one of the immunodisorders based on which system is affected, like the phagocytes, the B cells, the T cells, like that. Just sort of skim through there. I'm not going to ask you specifically to know which disorder goes with which dysfunction, but just have a, like, let me give you an example. The first one, phagocytic dysfunction. If you look at the clinical manifestations, those people are more prone to bacterial and fungal infections compared to somebody who has like a B cell deficiency. You know, those people might have, you know, like a deficiency in their, what am I trying to say? They're like their plasma cells and that kind of thing. So I don't need that kind of detail from you. What I really want is what do you do about these kind of disorders as a nurse? That's the most important thing I want you guys to take away from here. Basically, with all of these, is it doesn't really matter if they're having a bacterial, if they're prone to getting a bacteria or a fungus or a virus. We need to prevent it. The bottom line is you have to prevent it. We've got to do something to help these patients who have just lost part of their army in the front of their castle. So that's really the key thing as a nurse. So look at figure 36.1 and the warning signs of some primary immunodeficiencies. Some people that get recurrent infections and they can't get well and they're not responding like somebody else would, you might start thinking they have an autoimmune disorder, an immunodeficiency disorder. So look through that figure 36.1. The other thing that I really want you guys to focus on is, okay, let me go down here, medical management. Medical management, I want you to skim through it. Chart 36.1, that would be helpful to know because they do use a lot of IV immunoglobulins now, and that's pretty helpful in boosting the immune system. You'll get this too, like if you're working in the hospital and you get stuck with a needle, you'll go and get an immunoglobulin shot because it'll boost your immune system. It is important to know the immunoglobulin system, and I think there's a table in here about the different kinds of immunoglobulins. If not, we'll talk about it in class. There's like IVA, IVG, immunoglobulin A, immunoglobulin G, that kind of stuff. And they have different functions and different roles, and they can tell you a lot about your patient and when they've been infected and that kind of thing. So that's sort of important to know. Okay, now the thing I really want you to focus on after you skim through all of the specific disorders is what do you do about it as a nurse? The most important thing is you've got to know how to prevent it. So hand washing is the most, like, that's nursing 101. You just always wash your hands. Get the bacteria off your hands. Look at chart 36.2 on page 993. There's it discusses why hand washing is so important. And then the other one that I liked in here is chart 36.3. How do you assess for infection? Classic is temperature. The temperature is usually, not always, but enough that you should always do it, is take your patient's temperature, and if it's rising, that can indicate that your patient is developing an infection. Now, some people that have chronic immunodeficiency disorders, sometimes their fever center, they won't get a fever in the presence of an infection. Nonetheless, take the temperature. There are other ways to figure out if somebody has an infection, but don't neglect taking somebody's temperature. So look at chart 36.3 on page 994. That'll give you some other ways to assess immunology problems in your patient. And then I want you to start reading about promoting home-based and community-based care, because it's really important when you're taking care of somebody who has an autoimmune disorder, has an immunodeficiency disorder, or really severe allergies. What do they do when they go out in public? And how do they prevent getting infections? Because they are much more susceptible to getting an infection than somebody who doesn't have that. So you need to teach them, like, what do they do if they have to go on an airplane? Because we teach them they should avoid crowds, because when you're out in a crowd, you don't know who in that crowd is sick. You don't know who is sneezing and who's not covering, sneezing into their elbow. You don't know whose hands have been on what, and you're touching, different handles and things, and those patients are really susceptible to get further infections. So they need to be trained, and you're the one, as the nurse, you have to teach your patients, wear gloves, don't touch your mouth, don't touch your eyes, don't go out in public. If somebody, don't go in big crowds. If if you're a grandparent, elderly person, as much as you might want to see that little 2, 3, 4, 5-year-old grandkid, if they're sick, they're coughing, they're sneezing, you're going to have to avoid that. So things like that are really, really important nursing interventions, because you have to teach your patient about that kind of stuff. So on page 995, where it talks about promoting home care, I want you to start reading about how to educate your patient. Review chart 36.4 on the bottom of that page. And then I really like this critical thinking exercise, the first one, and I want you to try to go through that. What precautions would you take in a patient who has methicillin resistant Staph aureus, Staphylococcus aureus? That's MRSA. And the problem with MRSA, and the reason everybody gets all worried about MRSA, is that Staph aureus used to always be, if you gave somebody one of the psyllin antibiotics, it would usually eradicate it. It'd be fine. It'd be like so like the Staph aureus in this case is the enemy that's trying to get through the defensive lines, and you could assist your lines, you could support your lines by giving one of the psyllin antibiotics. Great thing to do. It's like bringing in reinforcements. Well, lately, the Staph aureus has, some strains of it have mutated enough now that in the presence of some of the psyllins, it doesn't eradicate it. So, and it's very difficult to get rid of. So that's why everybody gets all fussy when you hear about MRSA, and that's MRSA. So go through that and see if you can answer that. We'll go through it more in class, but it's really thought-provoking. Okay, so the next chapter we're going to go through is chapter 37, which is HIV and AIDS. And the reason that HIV and AIDS is included with allergy, immunodeficiency, and autoimmune is because it is an immunodeficient disorder that is brought on in the presence of the HIV virus. So it's one of those, oh my kitty, it is one of those, not acquired, opportunistic. It's an opportunistic problem that like AIDS is an opportunistic infection that shows up in the presence of HIV, because HIV causes a suppression of it's the T lymphocytes in this case, it's the CD4, and so so we're going to talk about that just a little bit. AIDS and HIV, it's not the big scare that it was like back in the 1980s and early 90s. The reason for that is we've gotten much better treatment. We know a lot more about it, but it's still fairly deadly. Again, as a nurse, one of the most important things you can do is teach the prevention of the spread, because the virus is found in bodily fluids. Pretty much all bodily fluids. So women who are pregnant, if that baby is born through the vaginal canal, vaginal secretions will carry the virus, and breast milk will. So those women should be taught to not breastfeed their babies, and the baby should be born via C-section. The other thing about HIV is there is a drug regimen called HAART, or the heart drug regimen, rather complicated, and I think there is, I'll find it, oh yeah, on page 1007 it's the antiretroviral agents, and you can see on that list how many there are. So usually what they'll do is they will put a patient, once they start developing symptoms, if they get the HIV virus, the goal for the nurse is to keep that patient really healthy. Good rest, good nutrition, avoid whatever it was, like if they got it through IV drug abuse or things like that, you try to teach them to not do that. If they are alcoholics, we try to put them on programs to get them to not drink, just to do anything to support their body while their body has that HIV virus, because what you want to do is prevent AIDS. Because you don't get to tell a person that they have AIDS until they have certain symptoms, and I'll tell you about that in a second. But going back to this antiretroviral therapy, it's really complicated. So if somebody is an alcoholic and they have HIV and they're an IV drug abuser, and they're not coherent enough, you can't put them on this regimen, because the problem is they have to take the drugs every single day at the same time. They can't miss it. If they do miss it, what happens is then the body starts building up resistance, and then it doesn't work. So if it's adhered to, it's pretty effective, but if it's not adhered to, then it's not effective. So it gets a little bit tricky about who gets to be on that regimen, and it's expensive. Okay, so do make sure that you know how HIV is transmitted, how to prevent HIV. This is huge. This is classic nursing. You've got to teach your patients, because they don't know this stuff and you do, so you share the information that's in your brain with them. Look over chart 37.2, health promotion. How do you protect somebody against the HIV? If any of you are interested in doing any work, like humanitarian work or missionary work, there is a huge AIDS epidemic in some of the developing countries, because they don't understand transmission, they don't understand prevention, and there's a lot of work to do. So HIV and AIDS is much more common in developing countries, and there's a lot of orphans caring for young siblings because they've lost both parents due to HIV and AIDS. So lots of work for nurses to do in this area, because it is preventable. Okay. I do want you to know standard precautions. That's just basic 101, nursing 101 on chart 37.4. Make sure that you are aware of what the standard precautions are. The figure 37.1 at the top of page 1003, that is a great diagram for how this virus infects the body. And what is the pathophysiology. That's good to have in the back of your mind. Because really, see that little CD4 binding site? That's the problem. It's the CD4 counts that you follow in your HIV patient, and you want to keep those CD4 counts high, because as soon as those CD4 counts drop below 200, then those T cells they're just exhausted. They're wiped out. You've wiped out all your T cells on the front of your defensive line, and that's when those opportunistic infections show up. Some of these opportunistic infections, and once the CD4 count is below 200 and in the presence of an opportunistic infection, that's when you can diagnose your patient with AIDS. And that you can read about that in the stages of the HIV infection, starting at the bottom of page 1004. And there was something else I wanted to tell you guys about that. So treatment, there on page 1008, there's more of the antivirals. I'm not going to ask you about those, but I'm not going to ask you about like specific dosages or things like that, but I do want you to recognize that some of these drugs are used for HIV. You're probably going to be tested on those at NCLEX as well. So just skim through there. They have unique names to them. A lot of them end in VIR, and you can remember that because it's a virus and you want an antivirus. So a lot of these you'll see end in VIR. That's just how I remember that, what class of drugs those are. Okay, so then the next thing that I want you to look at is the clinical manifestations of HIV when HIV starts, when the viral load, when the HIV virus gets high and the CD4 count gets low, then some normal bacteria, like the normal flora of the good bacteria that most of us, if we're healthy, it's not a problem, it's good, it like breaks down some things that we don't want anyway, like PCP, pneumocystis, pneumonia can start. And pneumocystitis is usually like not a big deal. No, it doesn't affect anybody until those CD4 counts get low. Then they can develop PCP. It is also called Gervais pneumonia, and that's that in the presence of PCP. Now all of a sudden you get this pneumonia, which normally nobody would get a pneumonia with in the presence of PCP. But in this case, if they've got HIV, then they can. Kaposi sarcoma, they can start getting mouth funguses, they can get tuberculosis, they can start developing cancers. This Kaposi sarcoma, you can see it, figure 37.3, is a type of skin cancer. So then the problem comes in is how do you treat it? Like, do you treat this person with chemotherapy because now they have sarcoma, but they also have a virus? So once these people, once the slope starts getting pretty steep, treatment for them is very, very difficult. As the HIV progresses and the AIDS progresses, you can start seeing encephalopathies. Your patient will be getting confused, combative, more difficult to manage. These patients tend to have some mental disorders. They start getting anxious, or they have a lot of depression because it's a debilitating and difficult disease to manage. And you'll see here on page 1013, you'll see how do you manage some of these opportunistic infections in patients who have HIV, like pneumocystitis, pneumonia I was telling you about. Skin breakdown is common. Nutrition therapy is huge, because you really want to keep these people healthy. Okay, now here's what I really want you to focus on with HIV. Starting on page 1016, see where it says nursing process and the patient with HIV and AIDS? That's the part I want you to focus on. I really want you to understand that. What kind of nutrition? How do we keep their skin intact? How do we assess and manage their respiratory status, their neurological status? What about their fluid electrolytes? How are we going to get them those extra fluid electrolytes? What are some good nursing diagnosis? And then you'll see in the next couple pages, there's an excellent plan of care. So go through that. What are the what's your diagnosis? What's the nursing interventions? Why are we doing those interventions? What are the outcomes? It is so important for you guys to understand the nursing process. So you've got an issue. You've identified the issue. Here's what I'm going to do to address my issue. This is why I'm doing it. That's your rationale. And this is what I expect to see. That's classic nursing process, and you'll be tested on that a million times. And in real life. So once you're like an actual nurse, you're not going to be writing it down. So like you do with your care plans right now, which is why it's so important for you to do really good care plans right now. Because by the time you're a nurse, you're going to have to do this in your head. You're not going to verbalize, alteration in nutrition. But you're going to know it in your head. My patient is malnourished, and hang on, I'm lecturing. Can I call her back? Okay, bye. Okay, so anyways, so go through the rest. Yeah, and so that's about it. The ethical dilemma is kind of fun too, but maybe we'll do that one in class. So, okay, so that's it. That's all I have for this week. Kind of complicated stuff, but it's cool when you start understanding the system that's designed to protect the body. It's really an efficient, really a cool system. And us as nurses, we just have to help support the system. Because when the system fails, when the allergic or immune system fails, now we've got other problems to deal with. That are much more difficult than if we just kept the patient healthy in the first place. So, okay, that was it. That was my husband. I've got to go call him back. So, call me if you need me. Okay, see ya.